So we'll go ahead and turn that on now. Great, thank you. And I'll send this over to Stacy to go ahead and get us started.
Great. Thanks so much, Caroline, and thanks so much, everyone, for joining us today. Um, for those of you who I have not met, my name is Stacy Auger. I am a policy consultant with CareQuest Institute for Oral Health. I have the great pleasure of co-facilitating the Dental Coverage Committee with Bailey Rivas from Families USA, Casey Wilson from Community Catalyst, and then several of my colleagues from CareQuest. So it's wonderful to be with you all, and I really appreciate you making time for this meeting today. For those of you who might be new to the Dental Coverage Committee, I just want to share, a slide about kind of what we are, and at its heart, what we are is a learning community, and one that really aims to bring folks together, from all of our different states and from various national organizations, and really to learn from one another and to support one another in the work that we're doing to advance and improve Medicaid and Medicare dental coverage. So we have, as always, a full agenda, and we're going to start by hearing. I hope Bailey is on. We're going to hear from Bailey first with some federal updates. We've got a lot going on, as always, right? But Bailey's going to bring us up to speed and also kind of do a recap of where things stand. Then we're going to move into some state updates, and really, we want to open it up to everyone to hear about what you're seeing and hearing and experiencing in your states, what you're planning for with the new legislative sessions coming up in just a couple weeks and months. And then our final activity together will be really to think about and do a group brainstorm of kind of where we are with things and what might be useful resources for everyone as we move into new legislative sessions and new and trying times. So let me see. Oh, Bailey. Oh, hey, Bailey. I don't
Hello,
have
I am
everyone up
here.
all at
I'm so
once.
sorry. I was having some Zoom tech issues, so joined a few minutes late.
No worries. So good to see you. So I'm going to let you take it over and give us the lay of the land at the federal level.
Yeah, well, classic federal government, super quiet. No, so I'll quickly start with the most time-sensitive conversation, which is around the extension of the EPTCs. I think it's been a minute since this table specifically met. So just as a reminder for folks, these tax credits, which about 20 to 22 million people rely on to get their health coverage through the marketplaces. These are mostly small business owners, contract workers, folks who aren't getting it through their job, and folks who aren't getting it through, spouse, etc. So these tax credits are set to expire at the end of the year. However, many folks are already now in open enrollment and trying to sign up for their coverage next year and are seeing that those tax credits are not reflected because as of now, they have not been extended. And so therefore, they're not reflected in next year's enrollment for folks that are in the portal trying to see what they have. There's been a significant push over the past couple of months, particularly from Democrats in Congress, to get these extended. They were the ones who originally created them during the pandemic, extended them in the Inflation Reduction Act, and are now trying to get them. I think the push for a long time has been permanent extension. I think as we get down to the wire, that time frame has been a little bit more up in the air. I think just getting an extension at this point is what many of us are really focused on. As part of the deal to close the government, 8 Democrats created essentially a handshake deal with the majority leader of the Senate, Senator Thune, to have a vote before this Friday on some kind of solution to extend these tax credits. I think those 8 Democrats were hoping that in the last 3 weeks since they reopened the government, that there would be some real opportunity to negotiate with Republicans and try and get some kind of bipartisan deal done because there have been some comments made from Republicans about interest in getting an extension done here. Unfortunately, over the last couple of weeks, those negotiations haven't really panned out. We've seen, while there might be a couple of Republicans who theoretically are interested in extending them, when we're talking about how to really change and improve healthcare, that's really not where they're interested in going. So Senate Democrats put forward what is essentially a partisan solution that will be voted on Thursday, which is a 3-year clean extension. So as they exist now, these enhanced tax credits will be extended for 3 years. We expect no Republicans to vote for that. It will not reach the 60 vote threshold to even get out of, to get by the filibuster, and therefore will fail. In the meantime, Republicans have been throwing out many, many different proposals around what an alternative solution to kind of or what they believe are alternative solutions. And then after a lot of back and forth, honestly, in the last 48 hours, there is a deal that was put forward by Senator Crapo, who is the head of the Senate Finance Committee. That is the main committee that deals with healthcare in the Senate. As well as Senator Cassidy, who is on the Finance Committee, as well as the chair for the Health, Education, and Labor and Pensions Committee, which is the main other committee in the Senate that deals with healthcare. And they've kind of put together this combined deal that is essentially mostly taking the money that is spent on these tax credits, shifting it to being money that is given to folks in the form of HSAs as opposed to in reducing premiums. The idea is that it's putting money in the hands of people directly instead of giving money to quote unquote insurers, which is what they believe the tax credits currently do. We at Families USA do not see this as an alternative that works for families, mostly because it's putting them in higher deductible plans than what they would be in now, as well as it's not actually giving them the money to pay for their monthly premiums, which is what is so important about the tax credits as they exist now, is it's getting folks that otherwise wouldn't have insurance into an insurance plan because it's lowering their upfront premium costs. And it's getting them into usually a higher quality silver or gold plans, which have lower premiums and lower deductibles than an HSA high deductible plan that this would kind of push folks into. So we expect that Republicans in the Senate will be having a vote on that at the same, kind of a side by side with the Democrats. Proposal. We don't expect either of them to pass. We don't expect that this like Cassidy Crapo bill will get any support from any Democrats. So it will not reach the 60 vote either. So at the end of this week, we anticipate that these like two pieces will both have failed. We expect at this point that the tax credits are likely to expire unless there's some kind of like Hail Mary situation that potentially comes out of the House. We know there's a bipartisan package from about 30 members of the House, the Problem Solvers Caucus, essentially, that has been put forward. That doesn't seem to have a path forward either. We know that Speaker Johnson said about an hour or two ago that he plans and hopes to have a vote on something related to healthcare on the floor of the House. But we're not entirely sure what that looks like, what that means, or if he'll even be able to hold that promise. So I think unless there's something that breaks really late in the House, we don't expect these tax credits to continue. So it's very frustrating. I know many of us have been working hard on this. Many folks rely on these or know folks who rely on these. And a lot of this conversation, I think, happened so late in the year, which was really frustrating when many of us were trying to push the conversation, when reconciliation was happening, after reconciliation happened. And here we are at the 11th hour, but, that's Congress. So there's some key pieces going into next year that I definitely want to quickly touch on, but happy to pause in case anyone has questions, since that was like a lot of information very quickly. Okay. The two pieces that I also just really quickly want to touch on. The first one, as the agenda notes, starting in January, there are some pieces of the HR1 bill that are going to start going into effect. I'm going to drop in the chat the link to the really detailed timeline. Oh, sorry. Part of that link is, anyway, the really detailed timeline that the Families USA team has created that kind of lays through exactly which pieces go into effect when. And I don't think there was, anything that we haven't talked about as this group. I mean, obviously the increased FMAP for Medicaid expansion states is going to sunset, I think is probably the biggest one in regards to like states and their legislatures like grappling with. And then there are some marketplace changes that are going into effect as well. The other big piece of news that actually is from yesterday is that Centers for Medicare and Medicaid Services put forward some guidance around the work requirement changes that states are going to have to start considering and crafting over the next year or so. Essentially, there's nothing extremely new or surprising in the guidance that they put out. A lot of it is essentially CMS reiterating what is in statute in regards to who is eligible and who is not. and some other pieces related to that. Um, there were just kind of three main areas that jumped out to our team that I wanted to flag. One is on demonstrating community engagement for renewal. They provide some flexibility regarding what beneficiaries have to show at renewal. So, um, essentially someone could comply by meeting requirements and just, if you're in a less defined job, like if you're a seasonal worker or if you're a contract worker that's not working consistent hours, there's like some essential flexibility added in for those type of workers when they're renewing to prove that they're, meeting the work requirement and still eligible for Medicaid. There's one on there's another piece of the guidance related to managed care organizations that I am candidly not an expert in, but happy to connect anyone with our policy team on that. And then there's another piece related to timeline for implementation, which essentially they're just reiterating that exemptions are going to be rare, and that it's unlikely that states will be able to delay implementation on that. So those were kind of the three pieces that jumped out. We are going to be putting out a resource on what is in this guidance, like very quickly, I imagine, early next week at the latest. And I will absolutely make sure that gets around to folks so they have it. I think what essentially our takeaway from this is that CMS is taking some steps to move forward on these pieces. They have not put out anything substantial yet, and they haven't put out anything for comment. This is just guidance to essentially say like, hey, we're thinking about things, here's where we're going with this. And once there are opportunities for actual commenting, for feedback from the public, we will definitely share that with folks. So I think we'll see more things like this popping up as the administration really starts implementing these pieces of the law. So I will absolutely share that blog round that will have all of the very specific policy details that I know folks here rely on. And as always, as folks are dealing with this, thinking through this, if they have any questions or need any advice, our Medicaid team, which are just absolutely brilliant policy minds on this, as well as I know Stacy and Caroline and Casey, like all of us are here as a resource as folks are grappling with what this means. So that's it from me. Sorry for that like frenzied, very wordy update. Happy to answer any questions if folks have any.
Thanks so much, Bailey. Bailey, I'm going to put you back on the spot for 1 second. Can you talk at all about the DHS's new proposed rulemaking around public charge? Sorry.
Yes. No. Thank you so much.
Yeah.
I see it's on the slide and I just
No, it's
fully so
sorry.
no, and so much has happened since we've all met as a group. And so it's anyway. DHS did put out a proposed rule that we've kind of been anticipating is likely to come out on public charge. It pretty closely mirrors what the Trump administration had done during their first term. They had put out this public charge rule. The Biden administration essentially undid it, and then now they are undoing what the Biden administration undid, going back to what the Trump administration first put into effect. And essentially, this makes it more difficult for immigrant communities, for immigrant families to access various types of public programs, but obviously, like Medicaid and healthcare being a really significant one, by making all of these additional requirements. And I think the biggest concern is that it creates a chilling effect where folks are concerned about even going and attempting to apply, even if they are eligible, even if they will be able to access it, because of concerns that their immigration status could then become a targeting facet. I will quickly grab a really helpful FAQ fact sheet on this from some of our partners in the immigrant space who have really been the ones leading this. The comment period on that, I do actually think is over, it ends next week. So I think in regards to submitting public comment, if folks are going to do that, like this week, and I think it's the 19th, I want to say. So like this week and early next week is really when folks need to get those in. And otherwise, once that comment period closes, the administration, will then consider those comments and move forward with finalization. And I imagine there will be lawsuits as there were in the past. And I think we can anticipate seeing a similar rule coming out of HHS, which is also what we saw happen under the first Trump administration. So there'll be likely more opportunities to comment as well. But essentially, this is just a redo of public charge from the first Trump administration. It's definitely concerning for immigrant families among the like many attacks that I know that community is dealing with right now. And it's just more things that make it less likely for people to access health coverage, which is deeply concerning. So
Thank you, Bailey. These are like, none of those were good updates, but we so appreciate you. So appreciate you sharing. The information is fantastic for us to have and hard to take in. It's a lot, a lot to take in right now. It's been a long year, right? With taking in a lot, and appreciate you keeping us so up to date on everything. Does anyone have questions for Bailey? I can't see it.
I'll just say I quickly dropped the PIF Coalition link in the chat around public charge. They also have a place there where you can submit, they have like a tool for submitting comments. So if you don't have time to do a comment or you want to submit one as an individual, they've got a great resource to submit that. But Jessica, I see you have your hand up.
Yes, hi everyone. This is my first meeting, but I just wanted to say thank you for the updates. And also, I had a question about, was there anything in particular? I work with individuals with special healthcare needs. I'm part of the regional center. Was there anything in particular that came up around that? I know specifically in California, Prop 56 cuts are going to happen. So I was just wondering from either state or federal level if there was anything that came up.
I do know, and I got the debrief from our Medicaid, like deep Medicaid policy expert on this. I do know that there has been one part of the work requirement rules that the disability community has been particularly concerned around. And my understanding is that the guidance that came out like didn't address that concern. It didn't guarantee that their concerns around I think like flexibility and how members of that community can ensure that they're not getting kicked out of Medicaid for eligibility reasons. The guidance didn't include any language that kind of ameliorated those concerns. So I think from that aspect, I think that is still something worth keeping an eye on in regards to the work requirement announcements specifically.
Awesome. Okay. Thank you so much.
Yeah. And if you have any further questions, I'm happy to connect you with our experts.
Wonderful. Thank you.
Jessica, welcome. We're so glad you're here for your first meeting. Thanks for joining us. Yes. So, are there questions for Bailey before we move into state stuff? Okay. Well, thank you, Bailey. And I know Bailey will be here for the rest of the meeting. So please, if anyone has questions, throw them into the chat. And, we, as Bailey said, we are all available afterwards and over email and through open communities. So please stay in touch as things come up and as you need more resources and support. So, Bailey just gave us this really helpful update of what is happening at the national level. Of course, everything that happens at the national has massive impacts down to the states. And so we've been talking about this for this past year about states prepping for changes that are coming. Some states have already started making some changes and some cuts. And so what I want us to do now is I want to open it up. I'm going to ask in a minute for Carrie from CPEN to give us an update, but we want to just walk through some things that we kind of have on our radar. I want to say that this is likely an incomplete list, but I wanted to use it as a starting point. So we know with changes that are coming down from the feds as a result of HR 1, as a result of changing guidance and input regarding community water fluoridation, vaccine, there is all sorts of stuff happening. Some has happened already, more is coming. Lots of states are kind of prepping and preparing and getting into a defensive posture. But, some of the states that we've seen things happen in so far, California, as we're going to hear from Carrie, has announced a cut for benefits coming up effective in July. Colorado, Idaho, and North Carolina have all put in place reimbursement rate cuts for their dental providers, as well as in all, I think all of those states, other providers as well. 2 states have implemented a community water fluoridation ban. I'm sure there are other states, sadly, that I am missing, but I will open it up to that in a minute. We also know there's a lot of states facing very specific threats. I think everyone right now is gearing up for changes, obviously because of the funding that's happening with Medicaid, but the ones that we're looking at right now that we have heard a lot about are Colorado. Colorado announced a number of big cuts this fall and then is also considering implementing an annual benefit maximum on their adult Medicaid dental program. I know many of your states have those already. This is something that Colorado has had off and on over the last couple of years. And then we're also seeing a number of states that are also going to be pushing up against community water fluoridation bans. But I want to say that the news is not all bad, and we have a number of states, and I'm hoping this list is going to get even longer after our conversation today, that while they're also in a defensive posture heading into the new year, they're also taking some really proactive steps to make some positive changes in the face of many negative things coming. But so we know our good friends in Arizona are working to get some legislation passed to have a legislative study that will look at the expansion of benefits for all adults. Connecticut is also looking again to expand their adult benefits. Florida is considering dental therapy to expand access to care across the state. Kansas is pursuing a reimbursement rate increase for their providers. And then New York has a bill right now, among many bills, but looking to create a veterans oral health program. So I always try to find positives in negative times. So I had to throw this slide in. But what I want to do now is actually turn things over first to Carrie Sanders. Carrie is the Senior Policy Director at the California Pan-Ethnic Health Network. She's going to talk to us about what is going on and what is coming up in California. And then I would really like to open it up to the full group and just hear what everyone is seeing, hearing, experiencing, kind of getting ready for as we head into a new year and the legislative session for 2026. But first, let me turn it over to Carrie. Carrie Sanders. Stop for a second.
Hi, good afternoon, everyone. Can you hear me? Okay,
Yep.
great. Yeah, so yeah, unfortunate news, but also you know, some hope. And so I'll just share a little bit about more about what happened in California this past year and kind of where we are right now. So as folks may have heard, our state budget eliminated or basically reverts back to emergency dental only effective July of 2026 for 2.1 to 2.3 million immigrants, including undocumented and certain immigrants between age 19 and above. Again, starting in July. So, California, as folks may know, is one of 23 states and DC that provides comprehensive oral health care for adults in Medicaid. We've done this before where we had eliminated adult dental in 2008, leaving most Medi-Cal enrollees without access to dental care for between 2009 and 2014. So a very long period of time. Except for residents in institutional settings and pregnant women. While dental benefits were partially restored in 2014 and fully restored in 2018, the consequences of the elimination of adult dental benefits from lower utilization rates to really a dismantling of the Medi-Cal dental provider network continue to reverberate today. So, this is, I think, very much a warning that, we have that legislators who were there during some of these periods, recall, and one that I think, is very, it's stark. We don't want to go back to, that period of time. For reference, our Medi-Cal program covers about 15 million people. So we're talking about 14.5 to 15 million, but we're talking about, again, approximately 2.3 million people who would be impacted by this, which is not a small number. Moving forward, as we look, towards this coming year, the state last year essentially balanced the budget on the backs of immigrant communities across the board. So this is one of a few other major cuts. Another was a freeze on undocumented enrollment effective January 2026. The reversion back to emergency only dental for those remaining undocumented and certain immigrant populations effective July 2026. And then we also approved $30 monthly premiums for these same populations effective July 2027. So really, it's very frustrating as a state, that we have chosen to dismantle. I think our our safety net, not only for undocumented, but for many immigrant populations that are here legally or have other types of status that for, traditionally we have chosen as a state to cover because we just, we know that that's the right thing to do. We're fighting to restore, all of these cuts. Um, and I think one important piece is while the freeze, the undocumented freeze is coming up very shortly within the next month. Dental cuts are not slated to go into effect until July of next year. So we still have 6 months and a full budget, another potential budget cycle where we, can fight back. And even if we, aren't able to fully restore a dental period, adult dental, we may be able to delay the cuts, right? So I think there are different options that, we're exploring. I would just say that, in an informal survey of our Health for All partners showed that, of the issues of most concern, dental ranked second. And so that was very interesting to us to see that, folks are very, very concerned about, what this loss means. We had we had a training recently with some of the CHWPRs, the community health workers, promotores, and representatives that we work with. And we got a lot of questions around, where can we refer people for dental coverage or dental services once these services are lost? And, it's really just a list of the state is providing a list of, dental programs like schools where, people can get maybe discounted services from students. That's really the sort of extent of of what is being shared at this moment. And there's no guarantee either of continuity of care. So we've the administration has said, if you're in the middle of dental treatment and your treatment goes beyond July, say you have one appointment in June and a follow-up in July, that's no longer covered. So you may not be able to see that provider. So just, we are still waiting. We're waiting to see to get a glimpse of the governor's budget. As I think a lot of other states, are in the same boat. There's a lot of concern around the impacts of HR1 on the state budget. We anticipate, a $30 billion loss to California over 10 years, which is, very serious cut. At the same time, and maybe kind of as surprising to all of us is our income tax collections have been strong in recent months, kind of growing at double digits, driven by the enthusiasm around AI, which I know is also happening nationally too. And we expect that this is going to be short-lived. So we are we're not sure, what we will see in this next budget. We're hoping to hold the line for sure on further cuts, but also, if there are any opportunities to try to restore dental to really, ensure that everyone can continue to access these services and the networks that, we've as a state have really been able to build up with the restoration of this benefit, that continues to be a priority for us and for our partners as well.
Thank you so much, Carrie. I want to echo your frustration with, watching these services that you in California, and all the states across the country have worked so hard to build up and create these networks of support and all of this. And it's so frustrating to see it coming apart. But I really want to pick up on the positivity that you brought, that we in California's case, and hopefully across all of our states, we have opportunities to launch defensive campaigns, to delay potential cuts, to mitigate harm as much as we possibly can. And I think one of the things that this committee, this learning community, is all about is learning from one another and learning what strategies are working and what solutions are out there. So this is like the time for us all to lean into each other hard and kind of and work together to find these. So I appreciate you sharing all this, and we'll be watching and eager to hear from you more as the new session gets going next month.
Thanks, Stacy.
Yeah. So I want to open it up. We have a number of states represented here on this call, and I'm not going to call on anyone just yet. So I'm hoping someone will just come off their turn their camera on, put up their hand, jump in, and tell us what's happening in your state. And we'd like to hear kind of the great things that are happening, positive work that is happening, but also what you're seeing that is maybe not great, and where your defensive mounting is starting to come up. So I'm gonna stop sharing my screen for a minute so I can see everybody. I'm hoping someone will jump in and share an update from their state and just talk about what's going on, what they're seeing, hearing, and experiencing.
So, hi, this is Release. I don't think my camera is working right today, but I do want to share that I'm from Detroit, Michigan. And so for us, we have two very new oral health therapists that we're so excited about. And the other updates I'm not ready to share right now. I'm still learning, but that is what I want to share about our therapists. We're very happy to have them, and we're looking to find two more therapists. And one of the universities, Ferris State, is creating a curriculum to be able to train, because our therapist now is being sent out to come back to us under contractual agreement to work. And so we'll be in a place that we will be able to train our own. So we're very excited.
That's a great update. I like it. Thank you so much, Lisa. Please keep us. That's really, really exciting, and definitely what we like to hear, like to see. Please keep us posted as those folks come back and as you get the new curriculum up and running. Congratulations.
Yeah, I was just
Thank
gonna
you.
say, like, yeah, the curriculum piece is also really exciting in the world of like looking for the wins. Like, these aren't necessarily always things that are purely just coming out of like legislatures, but like, what are the ways that within states, in places like that we can hold on to and talk about and share and all that jazz. So, yeah, echoing Stacey's thanks.
Yeah. Anyone else like to share? I know we've got folks on from Pennsylvania, Arizona. Let's see what's on here. Trying to put names with states. Kansas, I think Delaware, Louisiana. Am I doing a good job? I don't know. Someone like to jump in and share an update?
I guess I could talk
Oh,
about
yep.
what's going on in
Oh,
Kansas.
great. Absolutely. Please, Brian. And then we'll go to Nicole and I think Celeste. How about that? Good. Thanks, Brian.
We managed to secure a $10 million increase for dental rates last session. That's about 1/4 what's actually needed to come up to the level that Missouri has. And I know Jessica's on here from Missouri. Um, so we're going to go back to the legislature again this year and try and finish the job is the idea. But it's a big lift because the legislature is wanting to cut Medicaid, and they have a very truncated deliberative process so that things just go through in a great big hurry. But on the other hand, we have made inroads with legislators, and they do understand now many of them at least, the importance of proper dental care for folks on Medicaid. So we're hopeful that even though they want to cut the budget, that maybe there's a way to continue to expand. So that's basically the lay of the land here.
That's great, Brian. Thank you so much. I want to give a big plug to Kansas. I'm going to show a slide in a couple minutes before we wrap up. A new resource that CareQuest Institute has just released, set of resources, and their case studies on states that over the last couple of years have really made big improvements to their benefits. Kansas is one of these case studies and has done the work that many of you have been doing, which is this slow, consistent building of support and buy-in and real understanding within the legislature that makes holding on to these benefits and expanding them even more important and want something they want to do. So Brian, congratulations on all the work that Kansas has done. Definitely folks, check out the case studies. There's a lot to learn in them and they can be replicated. And many of you in your states, even if we haven't highlighted you yet, are doing this work. So for sure, keep it up. And Brian, we'll be very eager to hear what's happening in the new session and wish you all great luck with the rate increase. I think Nicole was next, and then Celeste, if that's okay.
Yeah. Great. So I can provide a quick update on Pennsylvania. I will start first regarding water fluoridation. Our legislator does have a bill introduced in both chambers that would ban the addition of fluoride into public water systems. However, based on our conversations, we have learned that there's not a lot of chance for momentum around those two bills just because of the preference for choice to be retained at the local level. Of course, we are continuing to monitor that at the state level. And of course, we're dealing with, threats at the community level who are getting a lot of misinformation and misunderstanding based on what they're hearing from the national level. Now, as far as Medicaid, things are a little bit more complicated, but I'm still going to say positive. So Pennsylvania runs a 2-year session instead of a year session. And our budget was over 100 days overdue from our June 30th deadline, but we were able to pass our state budget the same day that the federal government passed their continuing resolution in November. We, of course, have been advocating for about $20 million to be put into our state budget to basically eliminate our benefit limit exception and make the full dental benefit accessible for our Medicaid adults. We were not successful through this year's budget process. However, we are happy in that we didn't lose anything. So, while we of course want to enhance our coverage, we also know that the way things are going, we have to protect the ground that we have. So, we're okay in that sense. And I will also say we have a great support and working relationship with our Department of Human Services and being able to really listen to advocates, listen to providers, our FQs, and make changes or do what they can at the policy administration level to make things run better. And so we've been seeing increases in the approval of our benefit limit exceptions and really finding ways to improve and make that process easier as opposed to it being the barrier that it was when it was first instituted. So there is a lot of progress. Hopefully we'll be able to share more in the next few months, but not all bad here in Pennsylvania. We're just trying to stay positive and keep the ground we have. So thank you.
That's great. Thank you, Nicole. And definitely keep us posted. And I also want to lift up that is a very big win for you all. I know that working on the BLE and making that process easier and smoother, while also trying to, expand benefits is a huge success. So congratulations. And I know you have great relationships with your state leaders and with your, administrators. So congratulations and definitely keep us posted. Let's head south. Celeste, would you like to give us an update?
I am sorry I'm not on camera today, but a lot is coming through. Almost every second that I'm looking at my email, I have another email with another email blast. So everyone is staying connected as to the changes. Our governor basically made some changes that's going to reduce the number of people that are currently covered because of the plans that they're on. So it's looking like 1/3 of the persons who are currently on Medicaid will be changed from their current value added benefit MCOs, and that's gonna they're gonna get the notification between now and Christmas, and they'll have to either select a new plan from the existing ones, but Aetna and United Healthcare are going to be no longer be providers. The good thing is that the NCOs who are managing the plans will remain in place. And so they're fully aware of the changes that are coming, and it's going to affect like 488,000 Louisianians. But they feel like they can manage getting people into a plan within the time frame. And then the health department for the city of New Orleans has done a one pager in English, Spanish, and in Vietnamese on Don't Wait, Stay Covered. And it's basically to let the community know what changes are in place between the marketplace and Medicaid changes from 2025 all the way through 2029. So FQHCs and social services and that are working with Medicaid enrollment are actually taking that information and helping to educate their clients and their patients as to what's coming forward. So hopefully we can help navigate the adverse effects of what is on the horizon. So I'll have to keep you abreast as we continue to be bombarded with all information. I just got another email right before I jumped on this call, and I was like, oh, I have a patient at 2. And I was like, oh, I need to push this patient back to 3 so I could jump on this call because I was hoping to hear something in terms of what messaging might be happening on a national level that would help us on a state levels to help kind of either combat or formulate some kind of strategies for going forward, because I know Open and this Learning Collaborative have been very essential for doing that kind of work. So thank you for giving me the opportunity to share, and it's going to be exciting going forward, to say the least. Thank you.
Thanks so much. I like that. It's going to be exciting. Indeed, indeed. It will definitely all be at a fevered pitch for a while. But thank you for this update, and also for making time for this today. You asked about some resources, and I do want to share some. I don't have like an immediate answer, but I want to share some, and I'm going to jump ahead, and then we can come back to some additional updates. But so a few resources that I want to point out from today's call. This first page, and we will send this slide deck through following today's meeting. We have some resources from federal level updates, regarding provisions within HR 1, the work happening around the tax credits. I think one of the resources that Bailey also shared was about the rulemaking on public charge. And then we've got some information on community water fluoridation. At the state level, I do want to point out a bunch of things that we have that we've kind of put out recently. Again, this top one are these new case studies that CareQuest has just released. These are really positive. If you need some good feel-good things, please take a look at these. But they also are really great resources for messaging and just solid resources on how to advance things in your state. We did these for 5 states. We also have some defensive pieces out here that look at lessons that we have. Carrie was talking about how California's benefit has gone up and down over the years, and the impacts that coverage change has had. We've got a piece called Lessons from 6 States that digs into some of that a bit more. The ADA has a really great piece on what happens if the adult benefit goes away. We talk about any cuts to Medicaid or cuts to Medicare as well. So I want to highlight those ones, Celeste, and please reach out. We can help you with additional messaging for your state. Same for anyone. And then I do just want to share this is an old slide deck. I'm sorry, we'll send an updated one. We have 2 webinars coming up to let folks know about. One is being done by Community Catalyst around safeguarding affordable preventive care. And then we have an open advocacy committee meeting. I'll send better links for that following today, but I wanted to share those pieces with everyone.
I also just want to jump in and say I know that everything that's been going on in Congress is probably very confusing for the average person trying to figure out like what this means for them right now. And I think the biggest thing that we can communicate directly to folks is a lot of the changes, besides this PTC, this like healthcare tax credit expiring, which like folks are going to find out right now as they go into open enrollment to re-enroll. That's, I think, the thing that will be the most seeable and experienceable for folks. But I think the biggest thing to help them understand is like a lot of this doesn't go into effect for many years. So like people should expect to continue to, unless there are changes happening in your state to keep track of or to kind of add into the conversation. But from a federal level, like next year, people's Medicaid will continue to be the same. There will not be work requirements unless your state has put forward some. There will not be changes in how often they are required to prove eligibility unless your state has put forward something. But like from the federal level, none of those things go into effect until 2027. So I think it's like really important to help people understand that actually like right now it's consistent and they should continue to get insurance, to go to the doctor, to use their Medicaid coverage, all of those things are maintaining for folks. And while we need to be planning ahead for the fights that we know are coming down the line, and we need to be preparing for states that are going to be trying and rolling back coverage down the line, at this moment, people still have coverage. And it's really important that they feel that security that they still have it now, and that we'll continue to fight for whatever things are coming, but that for next year, things are the same.
Thank you, Bailey. It's a very good reminder. I think it's, for me personally, I get very caught up in all of it all at once, and it feels like everything all at once. And it's a good reminder. Thank you. Thank you.
It's tough as advocates, so we're always planning for the fights ahead,
Yes. Did anyone else have an update from their state that they would like to share? Just confirm. We're coming off.
If anyone also has had any conversations where if there are any major concerns that maybe it's not a bill that's proposed, but it's things that they know are top of mind for their legislators. I mean, I think obviously the changes from the federal level and how to deal with those, we know are very top of mind. But if there's just any other conversations or topic areas or quandaries that you all are hearing are happening at your state, would love to hear those too.
I'll chime in from Arizona. I think Jan's on the call too, but one of the reasons, and I don't know, I think I was on the last call, but there was a reference in a slide that we're going to do like a study committee. We got that idea because we've been looking at work that the Diabetes Coalition has done. And they did a study group and they've had some luck kind of getting some things moved forward. So we're going to take that approach because we're pretty sure we don't have a full comprehensive dental benefit. We've been trying to get it for years. We'll be one of those, we're a trigger state. So we're going to be upset with changes to Medicaid. And we don't want to lose momentum. We still want to have something going on, but we know our chances of really expanding care is slim to none. So hopefully getting a planning committee, study committee in place, we'll be able to kind of keep some conversation going. And so that maybe in subsequent years, we can get back to looking at comprehensive and at the very least have folks really be paying attention to keeping what we already have, which is, an emergency benefit. So we want to keep that in place. So that's kind of how we came to our planning, or I keep forgetting the stakeholder planning kind of committee that we're going to try and push for.
And that's great. I was really excited when I heard about this. I think especially in these tough budget years and these tough times, like anything, it's not small. Getting a legislative study and getting a commission together is not a small thing. But in this time, like that is so important. It keeps the conversation going. It keeps the momentum going. It keeps building your champion base, building all those things. And I love also that, picking up on some other wins that have happened in your state and kind of building off of that with the diabetes community is really exciting. Really exciting. And we have seen that it's a strategy we've seen in a lot of other states too that have really kept that ball moving down the field. I'm mixing probably analogies there, but you know.
No worries. No worries. Thank you.
Thanks, Jen. Anyone else? Well, in the few minutes we have left, if folks have some thoughts, we want to make sure, we've shared some resources here today, but we really always want to be responsive here and then also within our various organizations of what else we can be providing to you, resource-wise, messaging-wise, things like that, additional oh, yes, you did. Additional pieces that we can put out there. So does anyone have ideas of things or suggestions of things they would like to see come out of this committee or any of our partner organizations that would be helpful in your work in the next coming months and new sessions? Oh, it's Jessica. Sorry, I was scrolling too fast. Please jump in.
Hi, everyone. Can you hear me?
Yep.
Oh, okay, great. Thank you. So I'm just concerned about like the messaging. So particularly I'm in California around, I think, how earlier was mentioned that in California it's going to affect undocumented immigrants, but it's also going to affect, different populations as well. Specifically, the one that I'm speaking in regards to is individuals with special healthcare needs when there's already a fragmented system and already high unmet needs, access to care, health and safety concerns. What can we, how can we highlight that messaging around not just the immigrants, undocumented immigrants, but also other populations that are going to be deeply impacted with these cuts?
Yeah, that's a great flag. I know that there are definitely some federal groups that I'm sure already have some resources on that. So, Jessica, I'll definitely go ask and see where there are existing resources that we can definitely pull for that. But I think great flag that like as we move forward, just kind of helping delineate and be clear about like which changes are impacting which populations the most. And as folks are already struggling to like, as you said, deal with this like very difficult system, like how can we kind of help them from a consumer lens, like navigate through that? So I will definitely write that down for our team.
Awesome, thank you. Yeah, I just feel like there's the education piece, for the population in general, but even for dental providers, because I speak directly to dental providers and dental schools and all of that. A lot of them, if these cuts happen, a lot of them have mentioned that they will disenroll from being Medi-Cal dental providers and won't, re-enroll. So I'm just worried that we have come this far and then all of a sudden a lot of Medi-Cal dental providers are going to fall off and there's a huge need and we are already there aren't enough providers and we're going to get cuts even more. So that is a huge concern, at least in California.
Thank you, Jessica. We will definitely, as Bailey said, we will try to track down some resources and then also make this a topic that we're thinking about and strategizing on together as a group. Jan, I'm hoping, I know you always have great thoughts. You want to jump in on this one?
Mute. So just about the messaging part of it, at our annual meeting, big part of it was with Frameworks, who is very dedicated to open as far as creating messages for the group as a whole, for individual states, for individual organizations, and they do have, if you go, I think it's on Open, to the website, they are making appointments that you can schedule with the people from Frameworks about creating a particular message. So that might be something that I've already forgotten her name that was just talking. Oh my God, Jessica, what could do as a member of Open, and also maybe this committee pick something that we want to work about, a specific message that would apply across the country, kind of more universal message. And I think those universal message, it's one of my things, like work better in some situations, especially like adult dental benefits that everybody is facing in one form or another, and maybe try to figure out something specific we can do with Frameworks around that next year.
And
That's all.
that's a great call out. Thank you for Frameworks to not only tap into their individual technical assistance they can provide to folks, and Jessica, we can get you that information, but also thinking about how we can engage them over more in the year ahead and do some of that universal messaging. Thank you, Jan. So we are just about at time, but I want to make sure I'm not missing anyone. There's some questions in the chat about the does anyone know if their states respond to the federal rural health improvement grant included oral health improvements? This comes from Jen in Arizona. And Melissa has responded, our state anticipates the transformation news by the end of the year, by the 31st, but no, they have contacted states with questions about their claim. Oh, okay. So,
And yes, I'm sorry. Yes,
yeah.
we have included oral health in oral health training as well in our rural transformation grant here in Rhode Island. Sorry, I'm typing very fast.
No, that's okay. That's great. Thank you, Melissa. And maybe Melissa and Jen, Jen, excuse me, you can connect offline about this, see if there's any. We should maybe do a special session in the new year on the rural health transformation grants and kind of where things shake out. Okay, well, we are at time, and so I'm going to turn things back over to Caroline. If you have any final closeouts for us, Caroline, with us.
No, thank you so much, Stacey, and thank you all for all your participation. As Stacey said, we have upcoming Open Advocacy Committee. We'll have a follow-up email that sends to you all with all the resources mentioned here. As always, please feel to reach out to myself, Stacey, Francis, or Bailey if you have any questions via email. Have a wonderful, happy holidays, everyone. We'll see you all soon.
Thank you.
Thanks, everyone.